And the Bristol-based study Children of the 90s has been looking into the impact of lockdown on its participants. The first questionnaire they sent out on this was in April, and the data is already being shared with the government's Scientific Advisory Committee, or the SAGE Committee. The data shows a big rise in anxiety during lockdown, especially among younger people. Well, Professor Nic Timpson is the lead investigator for the Children of the 90s, and Stephen Hardman is one of the study's participants. Evening, Nicholas. Evening, Stephen.
Hello then.
Nicholas, we'll start with you first. What was this particular bit of research trying to find out?
So look, there's a two-part story really for the work we're doing with COVID with children of the 90s. The first thing is to do with, if you like, the biological readout of the disease. So what effect does it have on people? What's the impact of the infection on their health? And what might seem like relatively simple things, like how frequent are the subclinical infections in the general population, so those that aren't getting people to hospital but could be important for transmission. The second part of the story is to do with not just what the infection does to you, but the effect that mitigation or lockdown has had on us and had on our health. And you mentioned there some of the mental health related features. And actually, as we go through this long, drawn-out period of life change, those things are really important and, of course, sit against things like the way we're changing work, interaction with our friends and loved ones and so on. That long-term fallout is the second part of the story we're trying to capture.
Yeah, and what are the results shown so far? Because I know you've done the one questionnaire and you've got the other one out at the moment, and that data being fed back to the government's Scientific Advisory Committee already. What have the early results shown?
So, I mean, you mentioned a couple of them earlier on, which is absolutely right. So what we're seeing is spikes in anxiety and lowering in well-being. So these are mental health effects that we're seeing as a result of the imposition of lockdown. And also, as you mentioned, this doesn't look to be the same across the ages. So, for instance, we're seeing a much more marked effect of this in the young. Now, alongside that, what I think is fascinating is that we're seeing a relationship between that and contact patterns as well. So actually, our young folk are seeing fewer people in their day-to-day than some of our older participants. And that's coincident with their worse states of mental health and reports of increased anxiety. Now, all of that, of course, is subject to the way that we've measured things. This is self-reporting questionnaires. But these are really important signals if we're starting to think about the long-term effects of lockdown on our general population.
Yeah. Let's bring in Stephen Hardman, one of the study's participants. Stephen, how have you found lockdown?
So lockdown's been pretty interesting for me because I'm a doctor and I work in the psychiatry of old age. So particularly, Nick mentions the mental health implications. I see that firsthand at work in my older adult patients. So for me, lockdown's been interesting because I've gone to work somewhat as normal, but work's changed. And it's been quite different. And of course, it's affected, my partner whom I live with, who doesn't go out as much and who's much more isolated than I am actually. So it changes actually. I see people and I'm less isolated. And it's that isolation, I think, particularly for the rest of the family that has been a real struggle.
That's a really interesting point actually. And I suppose you're quite well placed, Stephen, given your line of work. You're quite in tune with how people are feeling, both physically and emotionally, I suppose. And so have you been able to pick up on how your peers and your loved ones have been responding to this?
So I think it's potentially a question of resilience. And I think the response is one, you mentioned, the isolation and the anxiety. And there's a lot to be said of that social isolation. And it's interesting what Nick says about the younger people, particularly actually, if you're not used to being by yourself for long periods of time and not seeing anyone, that has a massive impact. And, I remember earlier in your program, you talk about people who don't drive, and that has a massive implication.
Yeah, it's a very good point. Nick, were you surprised by any of the findings you've had so far, or did you expect some of these results? Because some people early on did say this is going to have an impact on people's mental health, this period of isolation. Were you surprised by some of the findings, or were they broadly in line with what you thought might be the case?
I think the standout effects that did sort of surprise me a little were the notion that the mental health effect is not necessarily the same across the ages. I didn't necessarily expect that. I didn't also expect there to be quite the difference in contact patterns across the age groups. And actually, just to pick up on one of the points that Steve makes there, what we're seeing is a readout of exactly the patterns he's describing. So those who have got exposure to risk but have occupations which are frontline and deal with risk, or have at least been, being able to go to work and conduct their day-to-day, not normally, but, in a manner which is, people can deal with it. Those guys are not showing the same anxiety patterns. I mean, maybe not a surprise, but actually you contrast that to other groups who, by occupation, are exposed and are anxious, but do not have the same training and background. So, we know from Ipsos Mori and some of these big reports on who suffers most. So the frontline drivers, taxi drivers and other occupations, they're in contact, they're exposed, but they're not clinicians. And these areas of disparity between training, contact patterns, whether you're isolated or not, do appear to have relationships in the health readouts that we see.
Yeah, that's very interesting. Steve, how do you find being a participant of Children in the 90s? Because, I better come clean. I'm also a participant of Children in the 90s. In fact, I did your latest questionnaire this afternoon because I thought, well, I've got no excuse. I better do it before I speak to you guys. How do you find it, Steve?
So it's kind of for me, I've always come from a scientific background. So my family, I guess, are very sciencey. And I guess it's kind of shaped my career and my life in a very big way, actually. So it's done by the University of Bristol, and I studied medicine at Bristol. And I think that's one of the reasons I wanted to study there, really. It's made me ask questions about, why are they asking these questions of me? Why do I do that questionnaire? And as my career's gone forward and I've learned more, actually, you reflect on certain things they asked. Actually, at the time, as a child, you wouldn't have realised. So it has a massive influence about what I'm curious about. Because as a child, you'd be curious, why are they scanning my brain? Why are they scanning my liver? And particularly now I work in mental health and I work with people who have, the stranger experiences. They actually did ask me lots of questions about those during the study. And it's only now that I, begin to reflect on that.
Yeah, it's really, really interesting. And of course, all this research the children in the 90s have been doing for decades now gets fed into policy and that kind of thing. And obviously the fact that this research is being fed back already to the SAGE committee is really interesting. Nick, for anyone who is a participant and hasn't yet completed the questionnaire, I know you're very keen for them to do this latest questionnaire. What do they need to know and what's the deadline? Okay,
so this is a really important thing to say that backs up Steve's point. Very rarely do we get real examples of citizen science where you, as a participant, be it interested in science or not, can make a real difference to the way that we're going to get through this problem that everybody's facing. So this is real, very, very real. And as you say, findings and data are actually being looked at and scrutinised by those who make policy decisions. So this is a really big deal. We need everybody that we can get. So if you are, part of ASPAC and Children of the 90s and you are, or actually somebody who was born in the early 90s in Bristol, North Somerset, South Gloss, this region of the UK, all they've got to do is they can text their full name and date of birth to 07772 90 90 90 and we'll do the rest. Or you can just go online to www.childrenofthe90s.ac.uk. It's as simple as that. You click in there, we can either bring you back into the study or continue your status as it is, and you can help this effort. It's really very simple, but it makes a massive difference.
Nick, Steve, thank you so much to you both for coming on the programme this evening. Fascinating chat. Professor Nic Timpson, lead investigator for Children of the 90s, and Steve Hardman, one of the study's participants. New research by Children of the 90s shows there has been a rise in anxiety levels since lockdown.